Hey everyone, this lesson is on an approach to acute diarrhea. So in this lesson, we're going to talk about a method for looking at the different causes of acute diarrhea. First, what is acute diarrhea? Acute diarrhea is defined as having diarrhea for less than 2 weeks. We make this distinction because when diarrhea is new and has been going on for a short time, it's more often caused by an infectious source, like a bacteria, a virus, or a protozoan. If it lasts longer than 2 weeks, it's more likely to be a chronic issue. Now, these categories aren't perfect, but this is what we usually work with. So, when a patient has acute diarrhea, the most important first step is to break down the possible causes into two main categories. We call these enterotoxic diarrhea and invasive diarrhea. Understanding the difference here is key to your whole approach, from figuring out what's going on to how you'll manage it. So let's break it down into these two categories. Let's look at enterotoxic diarrhea first. This is also called non-inflammatory or secretory diarrhea. With enterotoxic diarrhea, what usually happens is that bacteria release toxins that affect the cells of the small intestine. A good example is enterotoxigenic E. coli ETEC, or Vibrio cholerae. These pathogens release enterotoxins that don't actually kill the intestinal cells, but they trick them into secreting electrolytes, like chloride ions, into the gastrointestinal lumen. Water then follows, leading to a massive outpouring of fluid into the gut. There's no physical invasion into the cells, so there's no real inflammation or cell damage. Because the main problem is this massive fluid secretion, the main symptom of enterotoxic diarrhea is profuse, watery stools. The volume can be very large, which puts the patient at risk for dehydration. Since there's no invasion or inflammation, you typically don't see blood or pus in the stool. A high fever is also generally absent, though a low-grade one can sometimes happen. The classic example is Vibrio cholerae, which causes the well-known rice water stools. A much more common cause, especially for travelers, is ETEC, which is the leading cause of travelers' diarrhea. Other bacteria like Clostridium perfringens and Bacillus cereus, which you might see with improperly reheated foods, also fit this pattern. And it's important to remember that viruses like Norovirus and Rotavirus are very common causes of acute watery diarrhea and fall into this non-inflammatory group. Now let's look at invasive diarrhea, where the pathogenic mechanism is quite different. In invasive acute diarrhea, the infectious agent, oftentimes a bacteria, will actually penetrate and invade the lining of the colon. This leads to the damage and destruction of the gastrointestinal cells. This invasion can cause small blood vessels to break, which leads to bloody diarrhea. Because the pathogen is invading the tissue, the body mounts an immune response, sending white blood cells to the area and causing inflammation, which often results in a fever. The stool here really reflects what's happening inside. Because of the mucosal damage and bleeding, the stools are often bloody and can contain mucus. This is often called dysentery. Unlike the large volume diarrhea we see with enterotoxic causes, the stool volume here is usually smaller, but the patient may need to go more frequently. The inflammation also leads to other symptoms like significant abdominal pain or cramps, and something called tenesmus, which is a painful feeling of needing to have a bowel movement even when the bowels are empty. A high fever is also common due to the systemic inflammatory response. The list of invasive pathogens includes several well-known bacteria. Shigella is a classic cause of dysentery. Salmonella species, often from undercooked poultry or eggs, and Campylobacter jejuni are also major causes. We also have to mention enterohemorrhagic E. coli, or EHEC, like the O157H7 strain. While it works through a powerful toxin, the result is a hemorrhagic colitis, which places it in this inflammatory category. Another important one, especially for patients who have been hospitalized or have used antibiotics recently, is Clostridioides difficile. So to quickly recap the main differences. For enterotoxic diarrhea, the mechanism is a toxin causing fluid secretion. The stool is watery and high volume, without blood or significant inflammation. High fever is not typical. Invasive diarrhea, the mechanism is direct invasion and destruction of the intestinal lining. The stool is often bloody, contains mucus, and is smaller in volume. Fever and abdominal pain are common.